Okay. Hi, everybody. Thank you so much for listening in. I am sitting here with the Nikki Bergen, who is incredible. She is the creator of the Belle Method and the Bump Method. And anybody that follows Nikki or know who she is knows that she is the fitness expert when it comes to anything pelvic health for pregnancy and postpartum. I love, love, love watching her videos every day. And she has created such groundbreaking programs that you can actually do from the comfort of your own home, which is wonderful. She's a mom of two herself and truly inspiring. I'm so happy that you're here with us, Nikki, because I think that pelvic floor is so important in all stages, right? And because I work a lot with like fertility, pregnancy, and postpartum, there's always that part of me that's like, you need to go see a pelvic floor therapist. You need to do pelvic floor fitness. You need to, right? Because it's just no matter what stage they're in. So I'm so happy that you're here. Welcome.
Thank you.
Oh, good. Can you tell me a little bit of what inspired you to get into Pilates? Because your programs combine both Pilates and pelvic floor.
Totally.
Right?
Yeah. It's like a Pilates meets pelvic health is like a good way of thinking about it.
Okay.
But yeah, I mean, I started out first, I've been teaching movement for a long time.
Mm-hmm.
So 20 years. And I started out teaching dance. And then I taught all different types of dance, even starting at the age of 18. And then, it evolved and ended up teaching ballroom. I injured my knee while I was dancing professionally. And I discovered Pilates as a form of healing my body. And it was amazing and I loved it. And so I became a certified teacher. And I ended up loving that so much that I changed over from being dancing as my career to Pilates as my career. And this was in my mid-20s. So it's been a while.
Right.
I'm 40. And then I sort of discovered organically that I was having women come to my classes who were needing different things. So I was seeing women who had, pain and were dealing with issues, incontinence. Mm-hmm. And in my classes, I had women who were pregnant, in the same class as people who were postpartum, in the same class as like someone who was dealing with a hip replacement. Like it was just a bit like, I was like, I've got to like frame this.
Right.
And so I ended up creating programs specifically. So I have 3 programs. One's just for pregnant women, one's for postpartum women, and one is for pre-pregnancy and after the postpartum recovery period.
Okay.
So it's the most challenging. So the pre and post, and Belle is sort of like the really intense core fusion Pilates. So it's something you can hit every life sort of cycle, right? So pregnant mom will often join us and then continue postpartum, and then she'll graduate to the Belle programs. Okay. So what point postpartum would somebody graduate to the other program? Like, would you say a year later, 6 months later, or? It honestly varies by person. And this is a very great question, by the way, Jessica, because it does vary. So for women who were usually with us in pregnancy, mm-hmm. and they practiced in pregnancy and they did a lot of the prevention exercises, they will recover more quickly. And they will graduate to Belle, usually sometimes even around like 4 months, 5 months.
Okay.
And women who might have found us after with symptoms of pain or prolapse or diastasis recti, they could take, a year or even more before they feel confident and their body is ready for the additional challenge. So there's huge variability. I can't say, it's always 6 months.
Okay. So can you tell us what diastasis recti is? And does every woman experience this, during pregnancy or?
You know what? Every woman will experience a degree of abdominal wall thinning. So essentially what it is, and everyone's like, there's so much, I think 5 years ago, it started to become this big thing. And there are all these people talking about like, I'll help you fix your DR. Nobody wants ab separation. And there's a lot of fear around it, right? As you know, especially in the world. And so I actually did a video when I was like almost 40 weeks pregnant. And I think this illustrates it. So I measured my waist pre-pregnancy. So I'm not a very big person. It was 24 inches pre-pregnancy. And then at something like, 37 weeks pregnant, I had a 41-inch waist.
Right.
So that's a 17-inch difference between 24 and 41.
That's incredible. Mm-hmm.
Do you not think that in order to go from a 24 to a 41-inch waist, there has to be some give in your connective tissue and in your fascia.
Yes.
Right? It makes sense.
Absolutely. Yeah.
That, of course. And it's actually a miracle that we can have this happen. Our bodies are capable of creating space for this baby. But that happens, that space creation happens around your entire abdominal wall, but in particular in the fascial connective tissue in the middle of your six-pack muscle. So that's your linea alba, and that needs to thin and separate. Much like if you think of when you take silly putty and you pull it, it gets thinner, right?
Yes.
I played with it as a kid. I don't know if you did or not. But I think we're all familiar with like taffy, anything that you think you could pull, so your tissue your fascia gets wider and thinner.
Okay.
And weaker. And so that's diastasis. All diastasis means, it's Latin, it means separation. Recti means the middle of your two rectus abdominis muscles. So it's just the widening, thinning of that connective tissue. Now, can we prevent it? No. But what we can do is we can prevent it from becoming so severe that you have injury.
Yes, that makes sense.
We are all about minimizing it. We can't prevent it, but to some degree we can minimize it. And that's what we teach in the prenatal programs. Right?
Okay, that makes sense.
And caused by intra-abdominal pressure, which is essentially a fancy word for the pressure of a baby getting bigger and bigger and bigger, and your torso having to get wider to accommodate that baby's pressure. We want to not add any additional pressure to the pressure that already exists. Yeah. So this is why we don't recommend holding your breath when doing movements, because if you hold your breath, you're adding pressure. Don't strain when you're on the toilet, because that adds pressure. Don't hold plank after the mid-second trimester, because most women, that represents extra pressure and strain.
Yes.
In tissue.
Right.
So our whole thing is, how do we minimize the pressure to minimize the degree to which our abs have to stretch?
Okay. And this happens during pregnancy, that you would work on minimizing.
Being proactive by learning how to activate the transversus abdominis, which is the fancy word for the deepest layer of corset core muscles that wrap around your pelvic floor. And so all of these things, if you can learn to co-contract, so basically work both of those muscles at the same time, you're going to be in a much better place, both for pushing your baby out when it comes time to delivery and postpartum recovery. And so you'll see on my Instagram, I have lots of examples of hug the baby breathing. All I'm doing here is essentially a core compression or a belly contraction to help you really stay neurologically connected from your brain to that muscle. Anytime you put a lot of stretch on a muscle, sometimes it's almost like muscle amnesia can happen. And people are like, I feel very disconnected from my core because there's a lot of pressure and stretch on those fibers. So we want you to maintain that brain-body connection to those muscles throughout your pregnancy.
Right. Okay. And so a lot of women are told by their healthcare providers that they should wait 6 weeks, postpartum to do anything regarding exercise. Right. But obviously anybody who follows you knows that, week 1, week 2, you're already doing things, maybe not, intense, but you're already doing things to recover. And so can women start kind of immediately after? Should they wait a couple of weeks or?
Yeah, no, it depends on if you have had a vaginal versus a cesarean birth, right? So when you had a vaginal birth, generally you can start, and this is our 4th trimester online program, you can start the same week you deliver. And we're literally doing breathing.
Okay.
We're doing like lying on your back, do a bridge, do a single leg march. Like these are very
so just kind of like engaging the muscles again.
Engaging and rebuilding that brain muscle connection, which is imperative. And I always laugh because we're told as women, you don't do anything. And then in 6 weeks we get checked and it's like, okay, you're clear. And we're like, I guess I'm good to go. I guess I'll go have sex and go for a run because I'm good.
Oh yeah.
What? That's, I've got, if you get surgery and you need an ACL repair, you're not going to not do anything and then all of a sudden go for a run. You need to scale up. You need to progressively build your core. And if you want to start, and this isn't, I have to be careful because I don't want women to think that like, now this is another thing to do, right? You've just had a baby, you're trying to figure out feeding, you're trying to figure out sleeping, and all of a sudden now I'm putting this added layer of pressure. Now you need to do your core breathing. It's more that I want you to feel empowered and not afraid of movement.
Right.
You know what I mean?
Yeah,
So
absolutely.
don't think that you're going to do nothing and then all of a sudden go from 0 to 60.
Right.
You
Like
need,
go back to pre-pregnancy exercise, right? It's just not the same.
no, and
Yeah.
unfortunately, that's the message that a lot of women are getting. There's a
Right.
lot of fear. I'm not going to do anything. I don't do anything. Yet you're picking up your baby in the middle of the night. You're doing a lot of like functional movements, going down. And I'm in the minute. I'm 8 weeks postpartum with my second kid, right? So I'm going down, picking baby up in the middle of the night, or like the damn car seat. My kid's massive, 15 pounds plus the car seat, and I'm hooking it, and I'm getting in. It's a massive kettlebell. Are you kidding me?
Oh God, those car seats, they kill me.
Heavy. And I'm like, thank God I know like how to recruit and engage. But like women are lifting things that are, 15, 20 pounds, like
Yeah.
in weird, awkward positions.
Yeah.
And they're told, oh, don't do anything. You don't do your core breathing. Are you kidding
Yeah.
me? You need all the help you can get.
Yes. And I'm so happy you mentioned that because after Oliver, I remember, I think I was 5 to 6 weeks postpartum, and my midwife was like, "Oh yeah, you're good. Like just go back to exercising." And I decided when I was running, I don't even think I was actually exercising. I had to jog somewhere really quickly to grab something. I think maybe I was running after Ben in the forest or something. And I started jogging after him, and I literally felt my pelvic floor drop. Like I felt like my bladder was going to fall out. I felt like my uterus was going to fall out. I'm like, this does not feel good. Like there is something going on here. And so I'm so happy that you said that, because I think it's so critical. Like, and also I'm sure maybe you can speak about this a little bit, the more pregnancies we have, we tend to get, looser in the pelvic floor, you may have more risk of prolapse and things like that. And so is it even more important, the more babies you have, to get in on doing these exercises earlier and preventing?
I mean, it also depends on how you deliver. So there's a lot of women who also get more and more tension, not necessarily looser babies, but just think of it as more dysfunction, whether that's tension or weakness. So there's this misconception that, oh, I've had all these babies, now I'm loose down there.
Yes.
Sometimes you can have scar tissue from episiotomies or tearing, and the tissue gets tighter. Like think of any type of scar, how you heal, right? There's now like almost like a raised tense area. So what there is evidence to suggest is that multiple vaginal births, especially in close proximity to each other, which a lot of us are having kids closer together because we're getting older and we're like, crap, I want to have a bunch of kids. I better do it quickly.
Yes.
Right? So, if you're over 35 when you first start, like I was, you're like, if I want a second kid, I can't really wait 5 years.
Right.
Anyways, that's a whole other conversation. But yeah, so we're having kids older and in close proximity. And so, yeah, that's going to increase the strain on your abdominal wall. And that's going to increase the likelihood of developing issues like prolapse based on both your age and the, proximity of those births. That's for vaginal births. But yeah, it is very important that we know that we are able to be proactive. And I talk so much about that, but I also don't want women to think that if they're just watching this now and they're postpartum and they didn't do anything in their pregnancy, it's not too late. I get this question a lot as well. Like people are going, oh shit, like I missed the boat. It's too late.
Yes.
It's not too late. Like I have women, in their menopausal years going and finally getting, help from a pelvic floor physiotherapist, and it can make an impact. So this is meant to be an empowering message.
Oh, good. Oh, I'm so happy you mentioned that. So with somebody who has like a C-section then, do they still need to do the pelvic floor work? Like I know still the diastasis recti could happen for sure, but what about pelvic floor stuff? Because they're not, actively pushing. I mean, some do actively push for hours before ending in a cesarean. But if there was a planned cesarean, for example, and there wasn't that, pressure during the birth, is that the pelvic floor is still something they really need to worry about and look into?
I wouldn't want them to worry, but they do still need to work on their pelvic floor, because if you take those muscles, there's a web of muscles and your pelvic floor muscles are essentially all the muscles between your pubic bone, your tailbone, and your 2 sitting bones, your torso. As you're pregnant, essentially you go from something that's your uterus is like this big to the size of a watermelon. That's a
Right.
watermelon on a trampoline for almost 10.
Yeah.
So your
Right.
floor is dealing with a lot of strain just by virtue of being pregnant. So it's not that,
Mm.
everything's intact down there. Yeah, you might not be as at risk for things like prolapse because you didn't go through a long stage of pushing, for example. But a lot of women actually present with tension in their pelvic floor after section. So, and there's this misnomer that, oh, I want to be tight and toned. Tight is good.
Yes.
Tight is not good. Tight is not functional. We want to be
Right.
functional. So we want
Right.
just like it's Goldilocks. We want that perfect medium of like tension and flexibility, right?
Yes.
If you
Yes.
go jump on a trampoline that's very tight, like taut, it's
Yep.
going to be not a great experience jumping. Versus if it's very lax, it's also not going to be great, right? You want that perfect amount of give. And so,
Okay.
tension in your pelvic floor can also present as pain. So a lot of women who've had C-sections can have pain in their lower back, can have pain in their pelvis, can have pain with sex, can have a lot of pain. And often that's misdiagnosed. I have a story of my mentor who's actually a PhD. She got into pelvic health because she had twins, she had a C-section, and all of a sudden was having pain with sex postpartum. And her doctors were like, oh, it's because you're 35 and it's your hormones. Have some
Right.
hormone pills and some lube. And she was like, it's not helping. Turns out she had scar tissue adhesions from her C-section, and those adhesions were basically forcing a stickiness. So when you're having sex, the uterus needs to kind of move out of the way. The
Right.
uterus is moving. It was
Isn't
stuck.
that incredible?
Sorry for the visual, but it
That's
was like,
okay.
you get the point. So things weren't moving the way they were supposed to be moving, and she was experiencing very bad pain. And the doctors were like, they're not trained in pelvic health, and so they're like, oh, it must be hormones. And actually, she went for a couple pelvic physio appointments, and pain went away. So it's absolutely, to answer your question, important for women to see a pelvic floor physical therapist or physiotherapist, as we call them here in Canada.
Right.
Regardless of how you deliver your baby.
Right. And you just talking about hormones a little bit there kind of leads into my next question. So I feel like hormones are blamed for a lot of things, right? When it comes to women, we're tired. Oh, it's hormones. We're irritable. It's hormones. We're sad. It's hormones. And so it's all about the hormones, right? And I feel like people fail to look at, the other things that could be causing it. And so I have read recently that sexual desire could be linked to pelvic floor dysfunction and the lack of sexual desire. Is that something that I don't know if you know about that, or if like you can speak about that a little bit?
I think that from the perspective of your pelvic floor being governed by your autonomic nervous system, so it's not like your bicep, right? Like your bicep is like, oh, I'm going to go ahead and pick something up and contract and relax. Your pelvic floor does things that you don't even know it's doing. Unlike your bicep, right? You know what your bicep's doing at all times, pretty much. They did a study and they put these little electrodes on women's pelvic floors and showed them scary images. Well, what do you think happened? Take a guess. What happened to the muscles in the pelvic?
Everything went tight.
Yes, of course. It's like a very vulnerable area. I always think of a dog when they're scared, they tuck their tail.
Oh yeah.
Right? It's very similar to us. We clench our pelvic floor in response to stress.
So it's a muscle, right? It's
a muscle, but it's also something that we're often not even conscious that we're doing.
Right.
And so if you have had any type of trauma, whether it was birth trauma, sexual trauma, just constant stress, you're going to often have a lot of tension in your pelvic floor that would require sometimes counseling, sometimes a combination of counseling, stretching, pelvic floor physical therapy, all the things. And that is something that, is important to know, that it's not just like, oh, do these stretches. We have to really look at the mental piece as well, because it is such an emotional, vulnerable muscle. Yeah. And so, 100% it's related to libido. If you have had any type of tension in that area and sex isn't comfortable for you, or it brings up negative emotions or anything like that, 100% it's connected. Sure.
Oh, that's great. I love that you touched on that. Thank you so much for answering that question. And you mentioned something about the electrodes.
Yeah.
Now, there's a lot of information about pelvic floor health and diastasis recti out there. In your opinion, do things like the belly band or electrical stimulation and all of these things that you could use as like an adjunctive therapy, do they work? Do they make a difference? Because people are making tons of money on these things and women are spending tons of money on them. And I don't even know if they really know how to use them properly. Do you feel like if used properly at the right time and all this stuff that they do work? And if you do find they work, is there a brand or a company that you would recommend?
And you're speaking specifically about ab separation, diastasis, or
either one. I know with diastasis recti, there's kind of like belly bands, but for like pelvic floor issues, they even have like weighted balls that you can kind of sit within the vaginal canal to kind of like, exercise the pelvic floor.
So, okay, this is a big question. I am not a fan of waist trainers per se. So I it's great marketing. The Kardashians are brilliant businesswomen, bless them. However, and this is where I wish I had a tube of toothpaste right now, but if you think of your body's a tube of toothpaste, if you squeeze the middle of that tube of toothpaste, what's happening down?
Oh, it's getting larger.
Yeah, like you're putting a shit ton, excuse my French, of pressure on your pelvic floor downwards.
Right.
So women who are the best of intentions and they're like, I'm going to go ahead. And I was the other day, I get this question all the time. And I go and I just, for fun, I wanted to see how they were marketing it. And literally it looks like a Victorian corset. So the models in the shop page are like, their waist this big. And it's like, how is your breathing going to be in that situation? You're going to be breathing up here. And if you go on my feed, that is a big no-no, right? In terms of core function, you're totally turning off your pelvis and your core if you start to breathe up here. Right. And you're squeezing your midsection so everything's pushing down. So no, I don't recommend waist trainers. A belly wrap can be helpful, and there's a difference. So there's something that would be more of a gentle support, and these can be useful for women who've had C-sections who want a little extra counter pressure as they're healing in the first 8 weeks, say. They can also be helpful for someone who has back pain or someone who has had a more severe diastasis and is experiencing like their lack of core function, and they're picking their kid up or their crazy heavy car seat up and they're getting pain. So I recommend these wraps for a function of reducing pain and increasing confidence, especially for busy moms of multiple kids who need to be up and about, like managing life with older kids as well. They can't be in bed all day. So I recommend it from that perspective. I don't want anyone to think that wearing the corset is going to make their abs come back together, because that's kind of BS. It's BS.
Okay. I think that's even the message I got. I think I bought a belly band for when I postpartum with Ben. And, they're all about, you need to like lift, as they come across, make sure everything is lifted and all this stuff. But I found it was too tight. I would even loosen it and I still felt it was too tight. I felt restricted. I felt like I would just get more pain. I felt like in my back, because it was just, I don't know if I wore it too long. I don't know, but I felt like I could honestly wear it for maybe an hour and then I would have to take it off. Like I just felt so restricted, and I just forgoed it with Oliver. I just didn't even attempt it. And but I was totally under the impression that this would help with my diastasis recti, because I was, after the birth of Ben, I was 1 to 2 finger breadths of the diastasis, and then with Oliver 2 to 3. Yeah. So it was quite extensive. I had big babies.
What's up, Mama? I feel you.
Yeah. And it's interesting because I still feel that way. So I'm 6 months postpartum now. My bras still don't fit around my rib cage as well as they used to. Like my rib cage is like still quite large compared to how it was pre-pregnancy. My shirts don't fit. Like even though my waist feels like it's back to normal, my rib cage is still quite. So I know my muscles are still,
Yeah, and that can be very, very common. And I could talk to your ear off about ways that we can help mobilize your ribs to improve your breathing mechanics and also help those go back to where they were. But the baby, as your baby's growing, it grows up, and and eventually your ribs have to get bigger to accommodate the vertical length of that child. So make sure you don't get stuck in that feeling of your ribs. Essentially your ribs get bigger in pregnancy, and then it's almost like the baby comes out and your ribs are like, this is our new normal, we're just going to hang out here, thinking that the baby is still there, and it's not. So we have to retrain them to move again. So say pre-pregnancy, they were moving like this when you breathe. And when you're pregnant, they start to move like this. They move less.
Yes.
Because there's less mobility and there's more like your organs are being displaced up. And then a lot of the times we can get stuck in this restricted breathing pattern, even though the baby's now out of our body.
Yes. Yes. Okay. Well, thanks so much for speaking about that. Because it can seem frustrating for women, but what I think I love about you, Nikki, I mean, there's so many people out there who teach pelvic floor health, and, there's a lot of pelvic floor physios and a lot of people doing fitness. And what I've always been kind of inspired by you is your message. And I think that the message that you try to come across is that you normalize it, right? It's normal for pelvic floor issues, not maybe necessary issues, but pelvic floor changes to happen. It's normal for diastasis recti to happen. So I think a lot of women feel like that there's something wrong with them, right? And but it's so nice to know that there are solutions to help prevent things from getting worse. Like you said, you can't prevent diastasis recti from happening, but you could at least prevent it from getting, so bad that it's, causing you pain and injury, right? And same with postpartum, there's things that we can do ahead of time to kind of prevent, so if prolapse happened, there's things we could do to prevent it from getting worse. There's things we could do to lift it, so women don't have to go 20, 30 years before they go. Because I find that a lot of women kind of ignore it. And then, they sneeze and they still trickle, but they think, it's normal. And now they're 50, like you said, you get menopausal women in, and then it's getting worse and they're experiencing other things. And you're going, well, this is probably an issue, way back when. It just, so thank you so much for sitting with me today and talking about this. And I think that you really do inspire a lot of women. Is there a piece of advice that, if there was one piece of advice you could give women about their pelvic floor, what would you give?
Don't be afraid to talk about it. So the big thing would be that there are still women out there who feel shame and feel like they maybe did something wrong, or that they're embarrassed. And so, I think it's important that they seek help and they talk about it. And I think that they would be very surprised if they were to say, even just some of their girlfriends talk about it, they'd be like, oh, you get that too? So unless you bring it up, we kind of keep making it, as you mentioned, people feel like they have to just live with it, or they're ashamed of it. And, I think there's hopefully a new generation of moms coming up as the millennials start having kids. It's definitely more of a sharing culture, which I think is great. In this context, I think it's great to overshare a little bit to help women realize, like, wait a second, like, I don't need to live with this. And there is help out there. And I'm going to, and sometimes we're told, even by our physicians, oh, it's normal. It's common. And but it's something that you don't have to live with. There's a lot that you can do. So I guess, to summarize, it would be, don't be afraid to talk about it, and don't feel shame about it.
Oh, great. That's wonderful. Thank you so much. So where can people find you? What's the best way to connect with you? What's the best way to connect with what you're offering right now?
The website.
Website? Okay.
Yeah. So you can go to the website. It's thebellemethod.com, BELLE. And you can also find me on Instagram at the Belle Method.
Okay.
And we've got programs, virtual classes because of COVID. Now we've taken all of our classes online, which has been a journey. But the best part about it is that now we've got women who are all over the world joining us, not just in area. So we've got prenatal classes to prepare you for birth, prepare you for pushing, reduce all of the, diastasis, prolapse, incontinence. We've got the postpartum classes, and then we also have the Belle classes. So we have the three that I mentioned.
Okay. And so if somebody goes onto the website and they're just not sure which program that's perfect for them, are they able to contact you through the website or message you on Instagram? What's the kind of the best way to do that?
Either one.
Okay.
Either one. So yeah, you'll be able to find me.
Awesome. Well, thanks so much, Nikki, for taking time out of your busy schedule. I know you're very busy and you have a baby there. Is he woken up, or is he still?
I can't hear him. So you got total magic.
Success.
unicorns and rainbows right now. Like what? Yeah.
Oh, I love that. We were talking earlier about how I actually sent my husband away with my baby because I was like, I can't have the baby here. It's just not going to work. And so, yeah, that 8-week sweet spot is so nice when they're just relaxing and enjoying and looking around.
And all the texts are coming through. We were like,
oh, of course.
No, of course. They're all coming through.
That's okay. And we're done. So it's all good. All right. Well, thanks so much, Nikki. I'll let you get back to your baby and everything that you do. And anybody who is looking to connect with Nikki, I will definitely put her website and her Facebook and her Instagram information below. So you'll be able to connect with her and follow her. And I absolutely recommend any stage of womanhood that you're in to definitely follow her because she has so much to offer. Thanks so much, Nikki.
My friend. So thank you. Because you're doing all.
You're welcome. Oh, thank you. It's all about empowering women. We're all in this together, right? So yeah. All right. All right, Nikki, thank you so much.
Thanks for having me.
Bye now. Mwah.